Unfortunately, we do not have any very good quality data on a national level in terms of the burden of HI. We do know that this is ever increasing, so much so that this has become an emergency across the world. And unfortunately, it is disproportionately higher in countries where infection control measures are poorer, and therefore the burden is probably much higher in the developing countries because they don't pay enough attention to this and resources are not put into this basket. And therefore, we do struggle a significant amount with hospital-acquired infections. And the recent pandemic with COVID was a very good example to help us understand that even in spite of us taking a lot of infection control measures, there was actually a significant attributable mortality due to hospital-acquired infections. And it has highlighted to us that multiple pathogens are a problem in different parts of the country, and it is very different in every hospital. It is in fact different in various units of the hospital, and therefore it needs a more in-depth study and understanding for us to take this forward.
We should have a robust infection control committee and program which in every institution, and that should not be only restricted to private or tertiary care hospitals, that should be also extending to public hospitals. Also, you have a data collection, because only when you have data you can compare the several institutions or several systems of functioning, of how the hospital acquired infection is, and what it was last year and what it is next year, or what was the last month and what is it this month. I mean, you would know what is, and you go into root cause analysis of every sort of case which happens, serious infection, particularly in the ICU, what happens. Besides that, you have to provide enough physical support. I mean, staffing has already been raised by you. I think there should be adequate staffing. There are guidelines laid down again in the ICU, how much staffing you require for ventilated patients, for non-ventilated patients, and so on. Also, I think surveillance, important to isolate the patients, contact precautions and all. These things are not followed in many public hospitals. Other thing is, also quickly I will mention that the quality of antimicrobials also has to be regulated more stringently. You have to have a stringent quality control regarding people who are able to sell, manufacture and sell their antimicrobials in the market. So this will lead to proper quality of antimicrobials. This will lead to reduced unnecessary usage of antimicrobials.